Okay. Um, the discussion that we have this morning is on wheelchairs, just like I have said. And what I will be trying to do in my few minutes is to give some background information on wheelchair service provision that is going to allow us get the other presenters coming with the new interventions and new ideas that they are bringing into this sector of wheelchair service provision. So the first thing that we need to ask ourselves is about the wheelchair needs. About 10% of the global population, which we would actually talk of about 650 million to 700 million, is a population of people with disabilities. Studies have indicated quite consistently that 10% of that population, which can also be translated into 1% of the population, are people who need wheelchair service provision. So we are basically talking of about 65 million to 70 million of a population globally who need wheelchair service provision. And I'm sure you can confirm this with me, that 65 million to 70 million is a population that cannot be ignored. In 2003, this is some time back, but in 2003, 20 million people that required wheelchair services for their mobility did actually not have one. And there are also indications that only a minority of those that need and require wheelchairs have an access. It is commonly indicated that that could be a percentage of about 5 to 15% of people having an access to wheelchairs. It should also be noted that out of this group of 5 to 15% who require wheelchairs and have an access, not all of them have an access to what we would actually consider as appropriate wheelchair services. As we proceed, I will talk about effective and appropriate. An effective way of meeting the individual needs of wheelchair users is the provision of wheelchairs through a well-organized wheelchair service delivery system that is responsive to the needs of wheelchair users, respect their dignity, and is delivered by trained personnel. So that is quite critical to make it effective delivery. It's a system. On the subject of appropriate wheelchair, an appropriate wheelchair ideally should be able to facilitate the following things. One, easy transfers. It should also be able to offer greater mobility, meaning propelling with ease. Then the ability for folding and handling of the wheelchair, carrying out of activities for the wheelchair user, and moving around in the user's environment. And finally, proper feet and support for the user. I thought it would be very important for all of us as we gather here just to talk a bit about where we have come from. And as a matter of fact, it's not just where we have come from in terms of wheelchair services. The truth is this could be a reality in many countries as we talk. So what is the history? It all began with no standards. And everybody purported to do something on wheelchair service provision. Politicians were leading the pack, and especially during the time when they want to be voted in for positions in their government. Churches were doing wheelchair service provision. Mosques were doing wheelchair service provision. And that made it appear not to be like something that is professional, that needs to be handled by professional people. Now, what were the results of all these kind of things? The results were negative, because wheelchair users ended up having secondary deformities. They also ended up getting inappropriate wheelchairs. There was also, and there is also, lots and lots of wastage of resources, because people will receive wheelchairs that they will actually not be able to use them. But the same wheelchairs have costed lots and lots of money. Then, reduced opportunities for the wheelchair users. The wheelchair is not the end, but the wheelchair ideally should be able to give an opportunity for the wheelchair user to move on to the next level in their lives. But when they are fitted with inappropriate wheelchairs, it denies them the opportunity to progress on in life and minimize quality of life for the users. With all these kind of setbacks, it was quite clear that there was a need for guidelines in wheelchair service provision. Because if everyone will try to do something, then results and standards will not be there. So the need for the guidelines came up. And the guidelines came up, what is commonly referred to as the WHO guidelines on the provision of manual wheelchairs in less resourced settings. The issues covered in the guideline are the introduction to the guideline, subject on design and production, the service delivery, the training that need to go with that, policy and planning. In 2006, there was the consensus conference in Bangalore where the discussions of the guidelines were extensively discussed. And the host for this conference was World Health Organization, ISPO, and USID. And over 100 participants attended the conference, which meant that probably about 25 countries were represented. And that began the process of the guideline, which were launched in 2008, which sent a clear message that wheelchair service provision should be anchored to the set World Health Organization guidelines. What are the aims of the guidelines? There are three. One, it is to provide greater access to manual wheelchairs by assisting states to develop a proper system for wheelchair provision. Number two, to promote personal mobility with the greatest possible independence of persons with disabilities. And number three, it is to enhance the quality of life of users in less resourced settings through improved access to appropriate wheelchairs. Having said that, in my intro, I did say very well, there are a couple of other organizations that have come in with a mission to enhance the guidelines and make it much more practical in service provision, that people have got the capacity and they adhere to the set guidelines. Some of them is JPIEGO, based in the US, but with a couple of country offices across Africa. And one of the things JPIEGO has done or did last year and the year before was to do a wheelchair research or survey in 2 countries, one in Africa and the other one in Philippines. I mean, one was in Africa and the other one in Asia, which is Philippines and Kenya. Unfortunately, we had invited someone to come in and talk to us about that survey, but it wasn't really possible for them to come. We are happy that in the session this morning, we have MSH who are going to talk to us on what they are doing in terms of wheelchair service provision. And finally, we will also receive some information from International Society of Wheelchair Professionals. So in conclusion, the ultimate aim of wheelchair provision is to facilitate inclusion and participation. Thank you so much. The next speaker is Meredith, who is a project associate at Management Sciences of Health, commonly referred to as MSH, for the USAID-supported Leadership, Management, and Governance Project, LMG. Meredith provides management and technical support to a portfolio of activities to strengthen organizations that provide services to vulnerable populations and people with disabilities. Before joining MSH, Meredith has worked at the organization Tostan in Senegal as a regional assistant in Olesgu, Senegal, and M&E assistant in Dakar. Meredith earned a Bachelor's of Art degree in French and International Studies from the University of Richmond in the United States. So welcome, Meredith, for your presentation. Please change the presentation. What we need is for Meredith, technical team. What you have put on the screen is for John. Thank you.
Good morning, everyone. Thank you, Peter, for that introduction. My name is Meredith Schlessel, and I am a project associate with Management Sciences for Health, working on the Leadership, Management, and Governance project. For over 40 years, MSH has worked with donors, governments, civil society, health workers, and other health stakeholders at all levels of the health system to strengthen leadership, management, and governance capacities. And this work supports good governance, establishes inclusive and transparent processes, facilitates ownership and accountability, and fosters organizational effectiveness and sustainability. We have over 40 years of experience working in health system strengthening and have offices in over offices in over 50 countries and working in over 150 countries at the community, district, regional, and federal levels. We take our inspiration from the Tao way of leadership, where we work shoulder to shoulder with our local colleagues and partners toward their empowerment and success. So during this presentation, I will discuss the approach the LMG project has taken in working in the wheelchair sector through our support in rolling out the WHO Wheelchair Service Training Package, and share our key considerations and lessons learned after our 4 years of work in the wheelchair sector. Then I will dive deeper into some examples of successful stakeholder engagement activities we have experienced in the Philippines and Madagascar. And finally, I will discuss some remaining challenges that we would like to address to the broader wheelchair community. The Leadership Management and Governance Project of MSH is a 5-year USAID-funded project starting from 2011 and ending in September 2017 that improves leadership, management, and governance practices to strengthen health systems and improve health for all, including vulnerable populations. We're working in over 35 countries in Latin America, Africa, Southeast Asia, Middle East, and Europe, and provide capacity building for individual leaders, advocates, health and service providers, civil society organizations, and government institutions. Under our portfolio, we support organizations that work with survivors of victims of torture, civilians of conflict, children at risk, and persons with disabilities. LMG's work in the wheelchair sector began in 2012 to support professionals and partners from the local to national level in a variety of ways. This includes aligning global stakeholders, delivering the WSTP with local partners, engaging national level stakeholders, developing the training of trainers package, and developing a standard assessment for provider knowledge. In order to ensure appropriate wheelchair services and to better support the wheelchair sector, the LMG project works at the service provider, managerial, and national level to ensure there is a system in place for all 3 of these levels to work effectively separately, but also in conjunction with one another to ensure wheelchair services are of high quality and sustainable. We help partners and participants of our trainings to envision the entire system as a whole and how their role is an important part of this system. We recognize the need for all 3 of these groups to work together in order to be successful and appropriate in providing sustainable services. And so, for example, if we do a training in the basic level or intermediate level in a country, but center managers do not allocate the number of days for these wheelchair services, then the service providers are unable to practice their skills that they have learned in the trainings. And if we do not engage stakeholders at a national level, at a higher level, then it will be difficult for wheelchair services at the center level to be sustainable in the long term. And so the first level we engage is the service provider level. We support the delivery of the WHO Wheelchair Service Training Package, basic level and intermediate level trainings to prepare service providers with the skills necessary to provide the appropriate care that is needed. The second training is the training of service managers, where we train the managers of the different centers through the WSTP training for managers to ensure the trained service providers are supported and once the basic level and intermediate level trainings are delivered. This also allows the opportunity for managers to start addressing and improving upon existing challenges that service providers face. And additionally, this training allows for managers to improve upon skills and knowledge to support the addition of a wheelchair service in that center or to begin a wheelchair service. Our third level is engaging and aligning stakeholders of the wheelchair community in a systematic way to review the country's current situation, work with other stakeholders to identify gaps and challenges within the current situation, decide on key actions they can take to tackle common challenges to providing appropriate wheelchair services, and encourage national level stakeholders to work together to both identify and address these challenges. LMG provides a facilitated process based on the experience and knowledge of the attending stakeholders from the broader wheelchair community, of government representatives, representatives from local and global wheelchair organizations, and DPOs to align partners with the same vision and direction for the future of wheelchair services. Our stakeholder meetings also consist of service providers and center managers as well, who are able to offer a better insight into the realities that exist in the centers themselves. We believe that stakeholder engagement is critical at all levels, not solely just the top-level decision makers, for lasting change to occur. And so the LMG has worked to support the rollout of the WHO's standard package for wheelchair provision, and in total we have supported 19 basic level trainings, 10 intermediate level trainings, 16 trainings for managers, and 20 wheelchair stakeholder alignment meetings. As I said, the LMG project recognizes the need for training and coordination at all levels of the wheelchair sector in order for a country to move forward in improving these wheelchair services. We work with local partners who have strong relationships with key stakeholders and are committed to moving the wheelchair agenda forward beyond LMG support. Partners are chosen through an application process based on criteria set by LMG and USAID, and partners have varied from global organizations who already have a presence in the country, universities, rehabilitation centers, and ministries of health. Once the partners have been identified, we work to identify key organizations and individuals to be involved in the trainings, and it is encouraged and emphasized that providers are trained from multiple centers to ensure that several centers in the country have at least 1 or 2 trained staff on wheelchair provision in order to expand our reach. And if we are hosting an intermediate training, it is required that the participants have experience in basic level wheelchair services. We hold several meetings virtually or in person with the partners to better understand the situation of the country we are working in and design the trainings and meetings that build off already existing efforts. Lastly, we work with the partner organization to identify wheelchairs that already exist in the country that can be used during the training and identify wheelchairs that should be introduced to the service providers if necessary. Discussions are held between LMG, the lead wheelchair trainer, and the partnering organization to assess what the most critical needs are, the terrains of the cities, and to agree on what should be purchased. We try to find what is available in the country or region or continent before we procure from other parts of the world. Materials for technicians to make postural support devices and other adaptations to the wheelchair are also purchased locally and are only brought in from outside of the country if necessary. And so, for example, in May, we held a training in Liberia where we used a combination of appropriate wheelchairs that were already existing in the center, brought in wheelchairs from South Africa, and also were able to procure wheelchairs from a workshop in Sierra Leone, which was just right next door. And so after several years of rolling out the WSTP, global stakeholders, USAID, WHO, ISWP, and other wheelchair organizations have identified a bottleneck in rolling out these trainings due to the lack of qualified trainers to deliver the package. In July 2015, LMG convened a group of 21 international partners who have experience developing and delivering the WSTP to identify the standard core components that would make up the WHO Wheelchair Service Training of Trainers package. Since then, the TOT has been developed and piloted twice and will be piloted for the 3rd time in September in Bangkok. The final package is expected to be launched by WHO in May 2017. In addition to developing the TOT, we are also working with ISWP to establish a recognition process for the new trainers of the WSTP. And through our experience over the last 4 years, we have learned several key lessons and think that these factors may be essential for successful programming. The first is to tailor each intervention to each unique situation. Trainings and alignment meetings have been more successful when they are tailored to the country's context, whether it is a manager facilitating portions of the manager's training or working on an already existing policy document, When the people in the room are able to take ownership and relate to the content being discussed, there is more buy-in and support once the meeting is over and the country is able to take it on themselves. The second key consideration is to develop creative ways to engage stakeholders. Adult learning is different than when learning as a child, and sessions must be developed in a participatory way to keep adults engaged and eager to share thoughts, opinions, and knowledge. LMG assists in this facilitated process to pull out these ideas and make sure everyone's voices are heard and opinions are validated. The third consideration is routine follow-up by trainers and local partners. We recognize that one-off trainings do not lead to lasting results, and understand that routine follow-up is key to ensure trained service providers maintain the skills in the training. This can be done virtually by email or Skype with the international partners, in-person follow-up visits, and routine visits by the local partners who are able to visit the centers on a more regular basis. Additionally, newly trained service providers are encouraged to link with existing professional organizations or identify continuing education opportunities and mentoring networks. And so now I will discuss with you 2 examples of successful stakeholder engagement that we have experienced. As LMG is not a wheelchair service organization, we provide capacity building with local partners, and therefore we believe that stakeholder engagement is a critical element in building local capacity and moving agendas forward. And so the LMG began working with the Philippines in March 2014 through the rollout of the basic level training for managers, and stakeholder alignment meeting. Representatives from the Department of Health, university, DPO, and other local organizations already involved in working towards appropriate wheelchair services convened at this meeting to address key challenges the community was currently facing at that time. After better understanding the current situation of wheelchair services, the Department of Health became increasingly interested in developing a national training and recognition process for wheelchair service providers. Thus, an action plan was created to address the gaps in the capacity building of service providers. Over the next year and a half, the group convened to meet regularly and put what was discussed in this meeting into action. One outcome came from the government-drafted policy to support wheelchair provision through the National Health Insurance Plan. When LMG heard of this great news and progress being made and selected the Philippines for an intermediate level training, we took advantage of the opportunity to convene the group of stakeholders again for the follow-up meeting. So prior to this meeting, the government had drafted a disability and wheelchair service policy and was able to have it reviewed at the second meeting by the broader wheelchair community. The group also decided that they should establish the Philippine Society of Wheelchair Professionals to help advise on and systematize the National Insurance Plan. The Philippine Society has now been recently named an ISWP affiliate. The government is now supporting the WSTV training for local trainers. And so while the wheelchair community of the Philippines was already committed to moving the agenda forward, LMG served as a catalyst to bring them together in a systematized way and put their vision into concrete action. This success was brought about by a group of people deeply committed to improving wheelchair services in the country, and along with an increased commitment of the government to support the development of the National Disability and Wheelchair Service Policy. And so my second example of successful stakeholder engagement took place in Madagascar, where our first alignment meeting facilitated by MSH took place in May 2015, along with a basic level training. And so after this meeting, partners continued to liaise with the Ministry of Health on the importance of appropriate wheelchair services. And after a coordination meeting with the Ministry of Health, Ministry of Population, and other local partners to develop a national plan for physical rehabilitation services, the group wanted to go one step further and integrate a wheelchair service action plan into this rehabilitation policy. And so when we were holding a follow-up intermediate training it was at the request of the Direction Against Non-Communicable Diseases to make this wheelchair policy during the follow-up stakeholder meeting. A 4-day hybrid management and stakeholder meeting took place, where 2 days were spent going over key concepts from the manager's training, and then the second 2 days were spent developing this plan. So as a result, the draft policy was developed to support wheelchair services and will be integrated into the government's National Strategic Plan for Physical Rehabilitation Services once this plan is validated. And so overall, there was a large amount of support from the local partners and a push by the government to move the agenda forward and to collect data on the current needs and to work with donors and governments to keep the momentum going. Since the training and meeting in March, additional centers have started to organize and implement wheelchair services in other regions of Madagascar. And so despite the progress that has been made in the sector in improving appropriate wheelchair services, recognizing local trainers and support from the governments, there are still several gaps that need to be addressed. From LMG's experience in working in wheelchair sector, several challenges have been encountered regarding the availability of appropriate wheelchair services, wheelchairs, government support, and trained staff. And thus, we propose the following questions to the global wheelchair community to think about in future programming. And I know that I'm switching up the processes as everyone should be asking us questions, but now I am asking you all the questions. So they are, how can trainings be effective and sustainable when there is not a consistent supply of appropriate wheelchairs within the country? How can trainings be effective and sustainable when there is a lack of support from the government and competing priorities? And how can local capacity be built to easily identify and acknowledge local trainers and increase the number of trained service providers? And so these are very large questions that not only one organization can answer on their own. It is really something that the entire wheelchair community, rehabilitation community needs to work together and grapple with and come up with solutions. Thank you.
Thank you, Meredith, for the very informative presentation that you have given us, and also leaving us with some questions. Now, our final presenter is Dr. John Palman. Dr. John is the director of the International Society of Wheelchair Professionals and is an assistant professor in the Department of Rehabilitation Science and Technology at the University of Pittsburgh. John received his BS in Mechanical Engineering from the University of California at Berkeley and his Masters of Science in Mechanical Engineering from Cornell University with focus in biomechanics, and his PhD in Rehabilitation Science and Technology at the University of Pittsburgh. His research centers on assistive technology product development and quality control. Related to these topics, Dr. John Palman has several assistive technology design and development projects which are funded through the U.S. Veterans Administration National Institute. So welcome, Dr. John, and make your presentation.
Thank you, Peter, and thank you all for attending. I'm going to give a broad overview of what the International Society of Wheelchair Professionals has been doing for the last year and a half, and then tomorrow we also have a session related to wheelchairs that I'll go over in more depth some of the activities that are relevant to FATO and hopefully the audience. So ISWP's goals and objectives, I like to frame these in 3 different primary goals. The first one, and the overarching goal here, is to improve the quality of life of wheelchair users globally in 3 ways. By increasing awareness of the need for better wheelchairs and advocating for that need. By coordinating the global wheelchair sector. by coordinating the global wheelchair sector, and by setting and advocating for better product and service standards. And so I'll talk about examples of how we're trying to achieve those goals in the next 20 minutes. ISWP was started in February of 2015, so we're a very young organization, and we were supported and are supported currently with a USAID grant that goes until the end of June 2017. The structure of the organization is around a core group of individual and organizational members. We have an advisory board. We have working groups that are essentially standing committees that are volunteer groups that perform a lot of the activities, the majority of the activities of the organization. And then we have a leadership team, and that team is largely based at the University of Pittsburgh in the United States. Our advisory board has representatives from all parts of the wheelchair sector, so NGOs, many of our advisory board members are here in the room. We have NGOs, government agencies, funders, large wheelchair companies that operate both in the US and more affluent countries, and then in other less resourced countries around the world. Our working groups are in 4 different categories. The first one is advocacy. So as I mentioned, we're trying to raise awareness of the need for proper wheelchairs and proper wheelchair services and provision. Training is related to providing wheelchair services training, and that's largely based on the WHO materials that Meredith spoke about and Peter spoke about. Standards are related to products. So also Peter spoke about the need for quality wheelchairs and a lack of supply of quality wheelchairs. So we have a group focused on that and understanding whether the existing tests for wheelchair quality are sufficient to ensure wheelchairs that are provided around the world meet a high standard. And then we have a subcommittee focused on research, and that speaks for itself, but trying to work together so data that's being collected related to wheelchair users is consistent and it's collected in a shared way, so we can not just speak about small populations around the world, but we can speak about the global population receiving wheelchairs. So I'll go over some of the same material that Peter spoke about. So in terms of the need for wheelchairs, there's about 1 in 4 people who need a wheelchair who do receive it. So 3/4 of the population is not receiving devices. All of those, we consider all of those are in less resource settings. We say that total need for wheelchairs is approximately 68 million. Peter mentioned 65 million. We're all in a similar range here. When we start to look at the deficit or the numbers of wheelchairs every year that are needed, we start to divide that number by 3. We estimate that a wheelchair should last somebody approximately 3 years. So that means there's a need of over 22 million wheelchairs per year. Currently, the supply of wheelchairs is approximately 10 million wheelchairs a year. So the deficit is substantial. We need to triple the numbers of wheelchairs that are produced and delivered around the world. I like to put this need for wheelchairs in a global reference frame. This is something that the group that have worked in wheelchairs for many years recognize that it's a crisis situation, but around the world it's not recognized as that. And so as part of our awareness, we try to frame the need for wheelchairs relative to other needs around the world. So as I mentioned, about 68 million people are in need of a wheelchair. If we look at UNICEF statistics on the number of children who need access to school, that's 59 million. If we look at the prevalence of HIV, that's 37 million. So this is trying to frame this need for the growth and the capacity building in the wheelchair sector to a point where we all recognize there are other needs in other sectors, and so this is to help frame that argument. So I say that there's a global crisis in terms of the need for wheelchairs, but very few actually know about it. And so that's part of our mission to make sure that people are aware of this. So as part of this awareness campaign and raising awareness of this need, we've been running campaigns through social media and through our newsletters to raise awareness of this need. This is an example of one of our campaigns. This is framed around the recent GATE initiative at the World Health Organization and the acceptance and development of the 50 product list that the World Health Organization announced recently. How many in the audience know about this list? So look around, right? There's not very many. A minority of people in the audience know that just a few months ago at the World Health Assembly in Geneva, they announced a list of 50 products that they're going to promote around the world and encourage all governments to provide. So we tried to make this, we tried to raise awareness of this through our Facebook feed. There are 4 wheelchairs on that list out of 50. So we were able to reach over 200,000 people, get people to react to that post. 27,000 people reacted to it. And this was focused outside of the US, outside of basically where our focus is outside of the more resource settings. And so we started dialogues with people all around the world about the fact that these chairs are on the list and what the effect it might have in their local community. So this is one example of what our organization is doing. We're also, similar to what Meredith talked about, we're running stakeholder meetings around the world. These are pictures of a meeting that we ran in Bangalore that we partnered with one of our partner organizations. Similarly, we have a group from Motivation and our team going to the CBR conference in Malaysia in the next month to run a similar type of stakeholder meeting. We just launched within the last 2 weeks an awareness campaign, and so we have images and messaging that we've offered to other partners in a way to co-brand, and so I'll talk about this a little bit more tomorrow. This allows us to a win-win situation using messaging we all agree with to support FATO and possibly ICRC and HI to spread the same consistent message about the need for better products and better services in the wheelchair sector. As I mentioned, we're working on the research area. We have several publications related to the need for wheelchairs or the impact of wheelchair service provision around the world. 3 of those have already been published. They actually, in some cases, predate the society, the ISWP. But we've done work in looking at wheelchair breakdowns in Mexico, impact of wheelchair services in Indonesia. We've just published work that was collaborative work with MSH related to the basic test that we've developed to evaluate the competency of wheelchair service providers. We have another paper related to wheelchair standards that's currently in review. And just last week, we formed a partnership with the African Journal of Disability, and we'll have a special issue on wheelchairs that will come out likely in May of next year. And so we're encouraging anybody that researches wheelchair-related activities in the sector to submit a paper to that journal so we can raise awareness through that mechanism also. We're developing a set of policy documents, so building off some of the success that MSH has that Meredith talked about, we're developing a toolkit to help governments, ministries have a framework for policies that can support wheelchair services within their country. And so that policy toolkit is in development right now. It will include case studies of successes around the world of introducing policies into the healthcare system through the ministries in particular countries. It'll talk about best practices and then give examples of policy, frameworks that can be used hopefully directly into the policies within that country. So those will be ready early next year. In terms of coordination, that was the second activity that we're deeply involved in. As I mentioned, we have an advisory board who we meet every 2 months. We have working groups that meet monthly, which means that we have a meeting every week because of the 4 working groups. We have presentations like this that we attend and provide around the world. We're also partnered with other organizations to support their efforts in the wheelchair sector. UNICEF, we're running a survey for them to understand better the needs for wheelchairs in emergency situations for children. We have an ongoing collaboration with MIT and another USAID-funded project to evaluate wheelchair activity out in less resource settings, specifically in Indonesia in that case. We have a strong partnership with LDS, who has supported several activities that we're working on and sponsored several activities. And we're also supporting a Google.org project with UCP, Wheels for Humanity, who similarly, in collaboration with MIT, are developing sensors and will be monitoring the activity and the breakdown of wheelchairs of up to 5,000 people around the world. We have a website. Everybody has a website. We also have a website that helps people have one place to go where training materials are disseminated, where you can sign up to participate in our competency exams, where you can sign up for our newsletter, and you can read and connect with all the different working groups that are actively involved in the organization. We also have a product website, which is helping to market products and provide a platform for users to provide feedback. And so we're not selling wheelchairs. Our role here is to make sure that people are aware of what products are available around the world. So anybody in the audience that's interested in listing their products on that page, we'd be happy to do that, and we have a form on the website to request those products be accessed or to be listed. We have a calendar where we aggregate information from different organizations about trainings. It's not only what we're doing, it's what other organizations are doing in the wheelchair sectors to raise awareness of the different activities around the world. There's also a form where those activities can be added to our calendar. And any of the working groups that are running, those are online meetings. There's a link on our calendar where anybody around the world can click and actually observe and participate in that working group and listen in on what the activities are. So it's a very open, transparent process. With respect to standards, we, on the service side, we work collaboratively with MSH on a basic test. So this is testing competencies at the basic level for wheelchair service providers. When I did this presentation, we had 2 languages available. We now have 4, so we have French, English, Spanish, and Portuguese, and we have another several that'll come out over the next 9 months. We're developing an intermediate test. That's a competency test and a skills test. We've already gone through the process to validate the competency piece, and we're right now validating the skills portion of that test. And by January, that will also be available in English, and we're looking at translating that into other languages. Those, by the way, are free tests that we offer the wheelchair sector right now. Even different groups, organizations can have logins to our system. So if your organization does a lot of testing, then you can have your own login and load everybody that you want to have go through that test. And that can be something that our group can manage or your group can manage. So it's a service that we provide to the wheelchair sector. We have a credential program. The test is evolving slowly into a credentialing program, so you can be a credentialed wheelchair service provider. We receive funding from a separate funding organization to develop this credentialing program, which we're also developing. Similarly, that will be piloted early next year. This is very difficult to see, but I wanted to let everybody know the numbers of countries that we've had people take our test in. So it's all over the world, even though at this point we really only had 2 languages available. So as the number of languages grows, and I've already spoken with Mass with FATO and reaching out to all the members at FATO now that we have the test in French to increase the numbers of people that have taken it. We've had a total of over 1,000 people take this test. It allows us to benchmark the wheelchair knowledge on service provision around the world. In Africa, you can see the numbers of different countries that have, where people have taken it, including in Ghana. And so far, we've had people in 45 different countries take it. Related to testing and training as part of our capacity building and promoting service standards, we're building off and developing other training platforms. So right now, many of us are aware of the WHO Wheelchair Service Training Package. That is the basic level is a 5-day in-person course. We're trying to develop different platforms that might be useful in different contexts at a conference, for instance, or hybrid learning or mixed methods learning that other organizations might participate in. So one of the recent successes of our group is to develop, we call a hybrid training package or a blended learning. So there's an online portion and then there's an in-person portion. So we took something that's typically a 5-day in-person, reduced that to 3 days of in-person, and ultimately it saves money and time, and it puts it in a type of duration we think is more convenient for some trainees. We've piloted in Bangalore and in the US. We have upcoming pilots in Mexico and Colombia to specifically look at the knowledge gained in the course version that we've developed and compare it to the existing 5-day course published by WHO. So this is a picture of the course that we ran in Bangalore. This is a comparison of the knowledge gained. So in the blue is our basic test before they took the training course. This is the 5-day in-person, so this is how it was done according to exactly how WHO suggests. And the gains here are similar to the gains of our training package with fewer days in person. Statistically, there's no statistical difference in terms of the knowledge gain. So you have fewer days, lower cost, but based on the data we have so far, similar and no difference in the knowledge gained. Again, we're going to continue to run pilots and grow our data set to make sure that we in fact haven't taken anything away from the learning opportunities by reducing the number of in-person days, but so far we feel fairly confident that the materials deliver the same types of training experience. In terms of product standards, we have a working group that has members that have participated in international product standards for wheelchairs for many years. Large companies, wheelchair companies, representatives from them, from NGOs. And we went through a process of identifying whether the existing standards that are published by ISO are sufficient to make sure wheelchairs are reliable in less resourced environments, rugged terrains,